Hello, and thank you for joining this HCP Live TV Peer Exchange. My name is Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University and an associate director of surgical intensive care at the New York Presbyterian Hospital in New York City. Participating today on our distinguished panel are Michael Felker, MD, MHS. He's a professor of medicine, chief of the heart failure section, director of the Heart Center Clinical Research Unit, and director of the Advanced Heart Failure Fellowship at Duke University School of Medicine. Jim Januzzi, MD, Roman W. DeSanctis, endowed distinguished clinical scholar in medicine at Massachusetts General Hospital and Hutter Professor of Medicine at Harvard Medical School. And Christian Schulz, MD, PhD, Associate Professor of Medicine, Division of Cardiology at Columbia University Medical Center. He's also the Director of Research for the Center of Advanced Cardiac Care at Columbia University Medical Center. Let's set the stage, if we will. Heart failure is a complex clinical syndrome that is the result of impairment in the ventricle's ability to fill with or eject blood. Its key manifestations are dyspnea, fatigue, and fluid retention. In most patients with heart failure, symptoms are caused by impairments in left ventricular myocardial function, although heart failure can also result from disorders of the pericardium, the myocardium, the endocardium, heart valves or the great vessels, or from metabolic abnormalities. Approximately 5.1 million people in the United States are currently manifesting heart failure clinically, and this number is rising, in part due to the aging population. Despite major advancements in the treatment of cardiovascular disease, the American Heart Association predicts that between 2010 and 2030, the prevalence of coronary heart disease will rise by approximately 17%. And the prevalence of heart failure will rise by 25%. Within 5 years of a heart failure diagnosis, absolute mortality rates are approximately 50%. Additionally, heart failure is mentioned on the death certificate in 1 out of every 9 American deaths. More than 1 million hospitalizations are due to a primary diagnosis of heart failure every year. These hospitalizations are responsible for more than half of the total $30 billion a year plus that heart failure care costs in the United States. Early diagnosis and effective therapeutic interventions are crucial to reducing adverse outcomes in patients with heart failure. So here, we're going to spend some time discussing important risk factors to look for and then emerging treatment options that may help improve outcomes in the near future. So, I want to thank you again for joining us, and now it's time to get started. First, we're going to talk about risk factors linked to heart failure, and before we discuss ways to treat heart failure, I want to look at who makes up the heart failure population, as well as how to screen for and possibly even prevent it. So let's ask the basic question here. Dr. Felker, who is at risk for cardiovascular disease in general?
Yeah, so thank you, Peter. Heart failure is a common manifestation of all sorts of cardiovascular diseases. So the same things that are risk factors for cardiovascular in general, cardiovascular disease in general, are likely to lead to heart failure. Now, some of those things are things you're stuck with, your family history, or diseases you develop.
Your parents,
exactly, like hypertension, diabetes. Other things are very modifiable risk factors like your diet, your lipid profile, smoking, and physical activity. So I think all these, the same things that we think of as a healthy lifestyle in general, are associated with preventing heart failure.
You know, what's interesting across the board is if you look at, and it's becoming clearer and clearer to me as I get older and older, so many different disease states, whether they're cardiovascular or neurovascular or even cancer, seem to be affected by the same risk factors, whether it's smoking or diet. Is that amazing to you?
It just shows the multivariability of the development of disease, and heart failure is just a representation of that.
You know, a lot of them have a final common pathway. It's what you're doing, how you're living, what you're eating.
Yeah.
Yeah, it's important to emphasize the American Heart Association has drilled down on a number of important risk factors that predict future heart failure, and they really speak to better living, which is focused on weight loss, control of blood pressure, things that are modifiable. As we articulated in the ACC/AHA guidelines, the ultimate way to treat heart failure is to prevent it.
You know, I just want to stop for a moment and consider this, because people have been preaching this dogma for years, right? But no one's listening, it seems. They want a pill. They want a miracle medicine. They want you guys to give them something which will allow them to eat a lot of fat, not exercise, and smoke.
Well, there's data now. The HA has put out these are the sort of healthy behaviors that you can do to improve your cardiovascular health, and the data on what portion of Americans actually follow all those healthy behaviors is an incredibly tiny percentage, and those are the people who probably have very low risk anyway. So clearly, lifestyle modification, and this is particularly true in the U.S., I think we have a long ways to go.
Well, let's talk about heart failure.